Jet lag disorder is a sleep disorder. Look at this picture shows that, look at this, a detail going on. Introduction. Jet lag disorder is a temporary sleep disorder that occurs when a person's internal body clock is out of synchronize with the time zone they are traveling to. This typically happens when traveling rapidly across multiple time zones, causing disruptions in sleep, alertness, digestion, and overall daily functioning. While jet lag is temporary, it can significantly impact quality of life, especially for frequent travelers. Definition. Jet lag disorder, also known as circadian dysynchrony or time zone change syndrome, is a physiological condition resulting from alternateness to the body's circadian rhythm caused by rapid travel across time zones. This internal body clock becomes misaligned with the local day night cycle, leading to symptoms such as insomnia, daytime fatigue, and gastrointestinal issues. Etymology. The term jet lag originates from the combination of the word jet, referring to high speed air travel by jet aircraft, and lag meaning a delay or slowing down. It was first used in the 1960 to describe the fatigue and disorientation experienced after rapid travel across time zones. Epidemiology. Jet lag disorder commonly affect individuals who travel rapidly across three or more time zones, with up to 60 to 70 percentage of long haul travelers reporting symptoms. It is especially prevalent among pilots, flight attendants, and frequent business travelers, with eastward travel generally causing more severe symptoms than westward. Types. Jet lag disorder can be categorized based on the direction of travel. 1. Eastward jet lag. travel east shortens the day, making it hard to fall asleep. 2. Westward jet lag travel west lengthens the day, generally easier to adapt to. 3. North-south travel usually does not cause jet lag unless there is a significant time zone change. For chronic jet lag seen in frequent travelers, especially airline crews and business professionals, causes one rapid travel across more than two time zones, two disruption of circadian rhythms, three exposure to light at time inappropriate for the new time zone, for irregular sleep and meal time while traveling, 5. Lack of adaptation time. Risk factors. 1. Number of time zone crossed. The more zones crossed, the greater the effect. 2. Direction of travel. Eastward travel is harder to adapt to than westward. 3. Age. Older adults may experience more severe symptoms. 4. Sleep habits. Irregular or poor sleep hygiene increases susceptibility. 5. Stress or anxiety. High stress can worsen symptoms. 6. Frequent travel. Business travels or flight crew are at high risk. Complications. 1. Sleep disturbances. 2. Reduced cognitive performance. 3. Mood changes, irritability, depression. 4. Gastrointestinal upset. 5. Increased risk of error, accidents. 6. Impaired physical performance. 7. Weakened immune function. Pathophysiology. Pathophysiology of jet lag disorder step by step process. 1. Normal circadian rhythm. 1. Body has an internal biological clock, circadian rhythm, regulated by the suprachiasmatic nucleus, SCN, in the hypothalamus. This clock controls sleep-wake cycle, hormone release like melatonin, body temperature and digestion based on a roughly 24 hours light dark cycle. 2. Rapid travel across time zones. When person travel rapidly across two or more time zones, their external environment light dark activity time suddenly changes. The internal circadian clock does not instantly adjust to the new local time. 3. Mismatch between internal clock and external time. The body continues to function according to home time zone, causing a circadian misalignment. For example, in the new time zone, it may be morning, but body still think it is night time. For hormonal disruption, melatonin, the hormone responsible for promoting sleep, is released at the wrong time, disrupting sleep onset and quality. Other hormones like cortisol, which regulate alertness and metabolism, are also released inappropriately. 5. Physiological and neurological effects. This misalignments affects A. Sleep wake patterns, causing insomnia, excessive sleepiness. B. Cognitive performance, poor concentration, memory lapses. C. Mood regulation, irritability, anxiety. D. Gastrointestinal function, constipation, bloating, indigestion. 6. Gradual re-entrainment. The body gradually adjusts to the new time zone at a rate of one time zone per day. Exposure to light, meals, and social cues helps synchronize the circadian rhythm to the local time. This misalignment and the body slow adaptation process is the core of jet lag disorders. Pathophysiology. Signs and symptoms. 1. Insomnia or poor sleep quality. 2. Daytime sleepiness or fatigue. 3. Difficulty concentrating or memory issues. 4. Irritability or mood disturbances. 5. Headaches. 6. Indigestion, constipation or diarrhea. 7. General malaise. Diagnosis. Jet lag is usually diagnosed clinically based on 1. Travel history, number of time zones crossed. 2. Symptom onset following travel. 3. Sleep wake disturbance pattern. 4. Exclusion of other sleep disorders. Example, insomnia, sleep apnea. In some cases, sleep lags or actigraphy, movement tracking during sleep may be used. Nursing diagnosis. Common nursing diagnoses for jet lag disorder include 1. Disturbed sleep pattern related to circadian rhythm disruption. 2. Fatigue related to inadequate rest and disrupted sleep cycle. 3. Ineffective coping related to environmental changes and stress of travel. 4. Risk for injury related to decreased alertness or impaired cognition. 5. Knowledge deficit regarding strategies to minimize jet lag. Medical management. 1. Melatonin supplements to reset the body clock. 2. Hypnotics or sedatives for short-term insomnia. 3. Stimulants, example caffeine for daytime alertness. 4. Light therapy to regulate circadian rhythm. 5. Chronotherapy, adjusting sleep awake time gradually before travel. Nursing management. 1. Educate patient about proper sleep hygiene. 2. Encourage hydration and balanced meals. 3. Help develop a travel schedule aligned with the distinctions time. 4. Monitor and evaluate cognitive functioning. 5. Provide a calm environment conducive to rest. Treatment. 1. Melatonin taken before bedtime in the new time zone to help resynchronize circadian rhythms. 2. Sleep aids used temporarily to assist with nighttime sleep. 3. Light exposure, bright light therapy in the morning or evening depending on travel direction. 4. Behavioral therapy, cognitive behavioral therapy for insomnia CBT1 if sleep disturbances persist. 5. Gradual schedule shift, adjusting sleep and meal times before departure. Psychosocial medicine. 1. Stress management training techniques like deep breathing, mindfulness, and progressive relaxation. 2. Travel counseling, free travel guidance to reduce anxiety and improve adjustment. 3. Sleep education, educating about circadian rhythm and importance of sleep. 4. Social support, encouraging communication and companionship during long travels. 5. Lifestyle coaching, help with maintaining routines, diet and activity post travel. Prevention. 1. Adjust sleep schedule 2 to 3 days before travel to match the distinction time. To get sunlight exposure upon arrival to help reset the clock. 3. Avoid alcohol and caffeine during and after the flight. 4. Stay hydrated before, during, and after travel. 5. Take short naps if needed, but avoid sleeping too long during the day. 6. Use melatonin or light therapy frequently for long haul travel. In conclusion, jet lag disorder is a common but manageable condition caused by disruption of body's circadian rhythm following long distance travel across time zones. While symptoms can be unpleasant, they are typically short lived. With preventive strategies, appropriate treatment, and psychosocial support, travelers can minimize the impact of jet lag and enhance their overall travel experience. Early education and awareness are key in preventing complications and promoting well being during and after travel. Thank you. Have a nice day.